Vanakkam. Welcome to this course on biomedical instrumentation. We started looking at ventilators, and in this video we will look at classification of ventilators based on type of support that is provided, the type of power transmission, based on the pressure pattern, based on limits and based on cycle control. We did discuss this previously, just briefly. We will go a little deeper in this video. First, based on support provided. First is controller mode. In this mode, ventilator completely takes over the control and provides mandatory ventilation. In this case, the patient cannot breathe on their own either due to injury or due to anesthesia. In this mode, patient's efforts are absolutely not required or absolutely not expected at all, and because there is no trigger, the patient is not at all attempting to breathe. The second is the situation in which you assist. In this mode, patient is able to put some efforts, but they are not sufficient to completely take over breathing, or they are not as effective or as efficient. So, ventilator is performing in assist mode. It is assisting the patient. It is not the patient is assisting, rather the ventilator is assisting the patient. The ventilator detects the patient's efforts. There is a way to detect this as per the set, and depending on the target pressure or volume, it provides the appropriate assistance that is needed. The third is a hybrid, which is the assist control mode. In this mode, the ventilator works in assist mode primarily, but suppose if the patient can breathe, then no problem within the limits. If not, if the patient is not able to breathe on their own, then it provides ventilation. Sometimes ventilator may provide some mandatory ventilation. Even if it is assisting, sometimes it might provide mandatory ventilation to ensure that the patient is completely ventilated. Right. So, first is controller mode, in which there is complete takeover. Second is assist mode. Remember, who is the assistant? Ventilator is the assistant. Okay. Third is assist control mode, a hybrid between the two. Another way to classify is based on power transmission. One is direct transmission. In this case, the actuator directly pumps the air into the patient with the help of some safety valve and some inspiratory expiratory circuits. Second is indirect transmission. In this case, the actuator operates a secondary device. For example, this is a secondary device that then pumps the air. These are two different types of power transmission based classification. Right. One is direct and the other one is indirect. Recall that there is also electrical and mechanical or pneumatic, or a combination of the two. Electrical controlled pneumatic actuation, that is another possibility. Third is based on pressure pattern, positive pressure. This is the most common type of ventilators today. External pressure that is applied is greater than the atmospheric pressure, and so it pushes the air in. It is essentially like pumping of air. It is an active process. That means that ventilator pushes the air inside, but expiration is passive. Note that it is not like ventilator is pulling the carbon dioxide out. It just opens a valve, and expiration naturally is also passive. It just pulls a valve and then carbon dioxide escapes. Right. So, expiration is passive. During the expiration window, the safety valve is opened due to high pressure, and then air essentially escapes outside. This is in this mode, desired end expiratory pressure higher than atmospheric pressure, that is maintained, higher than atmospheric pressure. Okay. The other older type of ventilators is the negative pressure ventilator. In this type of ventilator, patient lies inside a chamber. This is iron lung ventilator type, inside a chamber, which creates a negative pressure on the body. This creates a vacuum that pulls the thoracic cavity, right, essentially creating a negative pressure in the lungs like it naturally happens in healthy normal case, right. But the face of the patient, the head of the patient will remain outside, so air will rush inside the lungs due to the negative pressure gradient. This is the other process. Surprisingly, there are still some cases where negative pressure ventilators are still being used or still has their applications. What are these cases? Cases in which for example, neuromuscular diseases. These are the cases that require biphasic curious type ventilators, right. And cases in which the patient might be pediatric neonate, non-invasive technique you want, otherwise you have to put the tube, the baby is very small, non-invasive case. Pediatric case. Another is other might be research, for example, space medicine, microgravity. This is research, of course. These are some of the other cases where it is useful. Okay. Then the other case is limits. First is volume limited. In this case, the control variable may be pressure or volume, but the amount of gas or the volume of gas that is delivered is limited to a maximum, which restricts the operation beyond that volume that is limited. So, it is the maximum limit of volume that is there, but the control variable need not be volume. The delivered amount is what is controlled, the delivered volume is what is at which point it will stop. So, the control variable itself or the trigger variable itself might be pressure or volume, okay, but the amount of gas delivered is limited. Pressure limited is the case in which maximum pressure is adjusted. So, you want to minimize, you want to control the amount of, or you want to control the value of pressure, that is maximally applied, because a higher pressure may cause damage. So, that is the other case, pressure limited. So, the maximum pressure is adjusted. Time limited, in this case the time that is given to the ventilator, that for which the ventilator waits before delivering the mandatory ventilation is adjusted. So, it waits for some time to check if the patient is breathing. If they are not breathing, then the if that time is exceeded, then the given specified time, by the way this specification is something that you can change, then the ventilator assumes that the patient is not breathing and then starts mandatory ventilation. This is time limited. So, it starts the inspiratory cycle as soon as it detects that the patient is not breathing. That is a time limited. Then different cycles may be controlled, different cycle control may be there. First is inspiration cycle, and in this there are 2-3 types. First is volume cycle, that is the expiratory phase begins only when a given tidal volume, a given volume of gas is delivered. When a required volume of, when a preset required tidal volume of gas is delivered, only then the expiratory phase will begin. This inspiratory-expiratory cycle is dependent on the amount of gas that is delivered. The second is pressure not limited, but rather pressure cycled, right. This is the situation in which the expiratory phase begins or the inspiratory phase ends when a particular pressure is reached, okay. When a particular pressure is reached, okay. This is called pressure cycled. The third is time limited. In this case, the time for which the ventilator waits before delivering the mandatory ventilation is adjusted. We already saw this. If this time exceeded, then a mandatory ventilation starts. Then you have expiration cycle. These are again pressure limited. In this case, the inspiratory phase begins once the peak end expiratory pressure is achieved. Note there is a difference. Pressure limited control is a safety mechanism. This is a safety mechanism, safety approach. Whereas pressure cycled is a cycling mechanism, fundamental difference. Okay. Next is time limited. In this case, the inspiratory phase begins after a set time. It waits for some time and then starts the next inspiratory phase. That is, it waits after for a set time and then it starts. Then patient cycle. In this case, patients or the efforts of patients are used to trigger a particular, whatever trigger that might be, used to trigger and then initiate an inspiratory phase. This is patient controlled or patient cycled. Okay. So, with this we come to the end of this video. In this video, we looked at various ways in which you can classify ventilators based on the support provided, based on power transmission, direct or indirect, or based on pressure patterns, based on limits and based on cycle control. With this, we end this video. Thank you very much for your attention.